Hello everyone, welcome to sqadia.com, and now in our fifth and final section of chronic pelvic infection, we will talk about some other chronic pelvic infections. In this, we will talk about the tuberculosis of the vulva, tuberculosis of the cervix, and also the infection caused by actinomyces. In the vulval tuberculosis, the patient usually complain of painful and tenderness in the vulva, and there is ulcer usually present in the vulva also. There is the confirmation of vulval tuberculosis is done by biopsy. And the medical treatment for vulvar tuberculosis is the same as for tuberculosis present in any other organ of the pelvis. And usually the treatment, if it's confirmed that tuberculosis is present, usually anti-tuberculin drugs are started for treating tuberculosis. If there is unresponsive to the treatment, then local vulvectomy. Usually the removal of the vulva is done if the treatment, if the vulval tuberculosis is not responding to the anti-tuberculin medicine. So vulvectomy should be performed. So here, these are all the diagrams of the infections present in the vulva, stained and unstained. This is here. These are all the different lesions. These are all the cells present in excess number during the infection. These also. Then cervical tuberculosis, usually there is, if there is cervical tuberculosis, patient usually complain of mucopurulent discharge, the discharge that contain pus and the mucus together, and there is also post-coital bleeding. After the intercourse, the patient bleed also. Cervical cytology, usually the cervical cytology is performed every 6 months. Q is for every 6 months. And on cervical cytology, we find if there is cytology or the specimen is not enough for evaluation, usually the cytology is performed again. If there is cytology or cells are within normal limit, usually what's done is we repeat the cytology after 6 months for HIV infected patient, and if there is a history of anogenital HPV infection or there is SIL. So here squamous intraepithelial lesion. So if the cytology is performed and if the tests are within normal limit, repeat it after 6 months. If the patient has a history of HIV, if there is HPV, what is present, or if there is SIL, which is squamous intraepithelial lesion. HPV, human papilloma virus, very common cause of cervical cancer, HPV. So if all these are present, if there is a history, usually the cytology should be performed, repeated after 6 months. If cytology is performed and it shows the changes which are usually benign, cellular changes are present, then we might be infection or inflammation. Then we treat the patient according to diagnosis and we repeat the cytology in 3 months. That will give you the idea whether it is improved after treatment or not. Then if the cytology shows if there are epithelial cell abnormalities, then we might be atypical squamous cell of undetermined significance. It might be low-grade squamous intraepithelial lesion, or it might be high-grade squamous intraepithelial lesion. So all these can be diagnosed if there is epithelial cell abnormalities, maybe atypical squamous cell present, low-grade intraepithelial lesion, or high-grade squamous intraepithelial lesion. Then we perform colposcopy with direct biopsy is performed, and colposcopy is examination of the cervix, and while examination the specimen is removed for biopsy. On biopsy, if there is dysplasia, abnormal cells present, or if there is no dysplasia. If there is dysplasia present, then gynecological consultation is important. Ablative therapy in which the lining or cells are removed, which have dysplasia. In no dysplasia, then we do the cytology again in 6 months. So this is the basic outline of the treatment plan in case and cervical cytology is performed 6 months depending on different changes. If specimen is not good enough, it's repeated within normal limits, repeat in 6 months under certain conditions. If there are benign changes, it is usually due to infection or inflammation. We treat it accordingly. If there are epithelial cell abnormalities, depending on what are the different types, we treat them, we do the biopsy, and then perform treatment. In actinomyces infection, it is a rare cause of upper genital tract infection. Infection is caused by actinomyces israeli, which is a gram-positive anaerobe. These are the actinomyces israeli, gram-positive anaerobe. Anaerobe means does not require the presence of oxygen for the growth, and it's gram-positive. When it is stained by the gram stain, it is stained. So it is gram-positive anaerobe. Usually associated with patients who are on IUDs, usually with non-copper devices, no copper device. These are the diagrams of endometritis caused by the actinomyces after the gram stain. So here, gram positive, they got stained by the gram stain, and picture of endometritis in which the endometrium is inflamed and infected. Diagnosis and treatment of actinomyces infection usually made by tubo-ovarian abscess when sulfur granules are observed along with gram-positive filaments. So sulfur granules are present in actinomyces infection. Treatment is penicillin, doxycycline, and fluoroquinolone. So antibiotic is effective for the treatment of actinomyces israeli. So that was all about the lecture topic, chronic pelvic infection. Hopefully you learned good about the chronic pelvic infection. So thank you for watching sqadia.com.